Hello friends, I hope you liked my videos and it's helpful to enhance your knowledge. If you are having any question, you can ask me in the comment. So in this video, we will discuss about the details of out of calibration and how to handle the out of calibration results. Friends, my YouTube channel name is Pharma Quality. So please view, like, comment and subscribe my channel to get the knowledge about the pharma quality standards and practices. Now in this slide we will discuss what is out of calibration. So here are simple definition of out of calibration. Out of calibration refers to a state where an equipment measurements or reading deviate from the expected or established standards, right? For example, you are calibrating the HPLC instrument for the test wavelength accuracy with caffeine and acceptance criteria of result for maxima at 273 is 273 plus minus 2 nanometer, and your result observed either below 270 or 276, that is above that 273 plus minus 2 nanometer criteria, right? Then this will consider as a out of calibration result and you need to initiate the out of calibration event, right? So when an instrument is out of calibration, it means that its accuracy, precision or reliability has been compromised. Right. That means your system is not suitable to use for further analysis. So now in this slide we will discuss the importance of calibration or why calibration performed, right? So when you are performing calibration of your equipment on defined frequency, then it ensures the equipment provide accurate and reliable measurement, right? That means result observed are matching with the specification limit. Next is it established a relationship between the instrument output and the value being measured. That means your equipment act as same what are expected, right? For example, caffeine standard has the melting point 235 to 237 degrees Celsius and your result also observed in between this specification limit, then you can say your equipment performance is satisfactory, right? Next is proper calibration enhance data quality, ensures regulatory compliance and boost confidence in the result. So now in this slide we will discuss which guideline talks about the out of calibration results, right? So first one is the EMA, that is European Medicine Agencies. So India Rolex Volume 4, that is Good Manufacturing Practices Guideline, describe about what are the expectation of out of calibration results and handling of out of calibration result, right? Next is ICS Q7, that is International Conference on Harmonization Q7, describe about the expectation of equipment calibration and maintenance, right? Next is USP, that is United States of Pharmacopoeia General Chapter 1058. So 1058 is for the analytical instrument qualification, which describe about the expectation of equipment calibration and maintenance in pharmaceutical laboratories, right? Next is NIST, that is National Institute of Standard and Technology, is handbook number 150 section 3rd, describe about the handling of out of calibration situations, right? Next is ASTM International, that is ASTM E177, that is American Society for Testing and Material E177 guidelines, talks about the estimating certainty in calibration, and ASTM E1326, that is American Society for Testing and Material E1326, talks about the practice for the calibration and characterization of analytical instruments, right? Next is ISO 13485, that is International Organization for Standardization 13485. This standards specify requirement for the quality management system in the medical device industry, right? It includes the provision for calibration procedures, equipment maintenance and handling of out of calibration situation, right? So these are the guideline which talks about the handling of out of calibration results, right? So now in this slide we will discuss about the handling of out of calibration results, that is details workflow for the out of calibration result, right? So many organizations are using the QMS software or TrackWise software to handle this OC initiation and closure process, and still a small organization are using the manual process to handle this out of calibration result, right? So first you need to initiate the out of calibration results, and then this out of calibration result shall be reviewed by the your user department head, and then it will move to the QA department, and QA department will initially review that OC result and they comment on that OC results, right? And further this will move to the other department if applicable, not mandatory, right? And then further OC results move to the QA decision, right? So QA head will evaluate this OC result, will be the major, minor or critical, right? Based on the evaluation they will make a decision and comment accordingly on the OC results, right? And further action plan proposal shall be done by the user department head, and then action plan allocated to the respective users. And further based on the action plan allocation, action plan shall be executed by the respective user. So your action plan may include the various hypothesis plan or other action plan, right? Since it is the out of calibration results, so it will impact on your analytical instrument performance, right? So we need to perform the quality risk management for the out of calibration result, and further we need to investigate the out of calibration result, and we need to find out the root cause of the out of calibration results. So it may be your assignable cause or probable cause, right? So based on the root cause identification, you must take the some corrective and preventive action based on the root cause identification, right? And further kappa shall be taken, and based on the your investigation conclusion, you can initiate your action plan closure, and effectiveness monitoring shall be open for the initiated kappa, right? And then once your all action plan has been completed and investigation has been done, and you have initiated your kappa, and you identified the root cause, then OC can be closed, right? And after the closure initiation by the respective user department, so further it will move to the QA department, and finally QA will evaluate the out of calibration result and investigation findings, and based on that he will close your OC results, right? So now in this slide we will discuss about the practical approach to make an investigation report for out of calibration result, right? So first is event description, that is problem statement. So here you need to elaborate about the details of out of calibration results observed, right? And also you need to give the details such as OC number, and so OC number can be assigned based on the internal procedure, right? So provide the details of equipment name, AR number, stage, date of occurrence, date of initiation, SOP number, and who has identified the out of calibration results, how it was identified, and where it was identified, right? So it's in such a way you need to describe the event description, right? And also along with this you need to define about the result summary along with the specification limit, right? For example, you are calibrating your HPLC system for the test wavelength accuracy with caffeine, right? And suppose you have observed maxima at 276 nanometer against the acceptance limit 273 plus minus 2 nanometer. So this will be going to your out of limit results. So for that you can initiate the event description, right? Next is immediate action. So here you need to describe about the action you have taken immediately after identification of out of calibration results. For example, on observing the OC result, it was reported to department head and QA head and initiated the out of calibration result into the system, right? And perform the preliminary investigation, and instrument is hold for the future users, right? So such thing you need to elaborate. So next is initial impact assessment, right? So here you need to elaborate about the initial impact with respect to the product quality and impact on batches, right? Next is investigation D. So here you need to define about the person who are involved into the investigation, such as name of person and their designation and their department, right? So such thing we need to elaborate. So next is investigation findings. So in this first is process flow. So here you need to define about the process step details and what can be the possible error for out of calibration result in wavelength accuracy with caffeine, right? So such thing you need to elaborate. Next is historical checks. So here you need to provide the details of similar types of out of calibration results with root cause and kappa. So you can consider the last 2-year data to check the same type of out of calibration results and provide the details, right? You can also use the various tools to find out the root cause, such as 5-wheel, fishbone diagram, FMEA, fault tree, and hypothesis, etc., right? So you can use these tools to identify your root cause. Next is data collection and interpretation, right? So here I am explaining based on the out of calibration result observed in the particular test and what are the possible situations, right? So based on the situation, your investigation may change. So here I am explaining just for the understanding purpose, right? So the first is laboratory area review. So you need to check the temperature and relative humidity criteria for the laboratory, that is your calibration is performed under controlled condition, right? Next is preventive maintenance verification. So here you need to check the preventive maintenance is performed prior to start the calibration activity, and details of preventive maintenance performed you need to elaborate, right? Next is column review. So here you need to check the details of column used, that is column used is having the right dimension and characteristic as per the details which is mentioned in the SOP, right? Next is analyst details. So here you need to define about the analyst details, who has performed the calibration and by whom out of calibration results observed. So here you need to check the analyst qualification details and their training, right? That is he or she is trained and qualified to perform the instrument calibration. So such thing you need to elaborate, right? Next is used chemical details. So here you can define the chemical reagent and solvents you have used during the preparation of the the test, right? So here you need to provide the details of chemical reagent solvent use details, that is name, make, and batch number, expiry date is, right? So such details you need to define, right? So now next is used standard details. So here you need to provide the details of standard use, right? That is name, make if applicable, and batch number and expiry date. So such details you need to define, right? Next is review of calibration method. So here you need to check the details calibration method with respect to the SOP to verify that calibration method and parameter which are mentioned in the SOP, that same was applied and used during the calibration, right? So next is the physical verification of instrument. So here you need to check physical condition of the instrument and check the proper dipping of all port into the mobile phase bottle. So such thing you need to check and elaborate. Next is review of data sheet. So it is the sheet where analyst done the reporting, that is preparation details with respect to the standard mobile phase and column used and instrument method used, right? And so such things you need to cross check and elaborate into the reports, that is it is satisfactory or not, right? Next is review of sequence. So here you need to check the all information are correctly mentioned in the sequence, including the right instrument method. So such thing we need to check. Next is review of pressure channel. So here you need to check the pressure graph throughout the sequence and ensure that there is any pressure fluctuation was happened or not, right? Now the next is review of chromatogram. So here you need to check about the chromatogram, that is about the peak shape, peak tailing, and peak fronting, and peak symmetry, right? So such thing you can check into the check for the chromatogram, right? Next is service engineer investigation details. If you have not identified any assignable or probable cause with this preliminary investigation, then you can approach to your instrument service engineer to provide some technical input, right? So in such a way you can investigate. So always keep in mind that this is just for the training purpose, and your investigation may be different based on the out of calibration and the situation uh, observed, right? Now the next is root cause assessment, right? So first is hypothesis details. So here you need to perform the hypothesis based on the scientific rationale. So you can plan many numbers of hypotheses which indicate that this could be the cause of out of calibration results, right? So you can plan the hypothesis accordingly, right? So based on the hypothesis you need to identify assignable root cause or maybe your probable root cause, right? And next is recalibration. So after identification of root cause you need to perform the recalibration, right? Next is human error evaluation, that is if applicable. If there is analyst error, then you need to evaluate the what error analyst has made which leads to out of calibration result, and the details of analyst, right? Next is root cause conclusion. So here based on the detailed investigation you need to elaborate the root cause details, right? It may be the analyst error or instrument related error, right? So now next is impact assessment based on the root cause identified, impact on batch or any other. So here you need to elaborate about the details impact, right, with respect to the product or batches, right? Since this is the out of calibration result observed in HPLC for the test wavelength accuracy, so if you have identified the analyst error, then there will not be any impact on the instrument performance. And if you have identified the root cause which reveals out of calibration results observed due to instrument related error, then you need to perform the impact assessment thoroughly, right? For example, you may need to evaluate the all product analysis since last successful calibration to till date, right, based on your identified root cause. Next is kappa and effectiveness monitoring. So here you need to describe about the what corrective action and preventive action taken based on the identified root cause, right? And also you need to open an effectiveness monitoring of this kappa to check the kappa taken is effective or not in the future, right? So such thing you need to evaluate and define, right? So friends, this is all about the out of calibration. I hope it will help to understand the concept, right? So thank you so much for watching the video.